Hey girl, hey, it's your birth bestie Nurse Rini, and I am back with another Reddit story from the subreddit Pregnant. Guys, on this channel, we do childbirth education, lots of free, good, factual, expert information out there on my channel. But also, I want to grow a community. So if you have questions, comments, or concerns, definitely leave them below because I guarantee you are not the only one with this question. We do childbirth education also by looking into the subreddits and seeing what questions that the ladies have so that we can answer them for the masses. So make sure you like, comment, share, and follow for more. Please. Now let's dive in. This user says, I want an elective C-section, but I'm uncomfortable admitting it because there seems to be so much judgment around that, and I totally agree with her. Let's dive in. Reasons why I decided to go for an elective C-section are, on one hand, because pregnancy has been brutal and I've had every single common and uncommon symptom one can imagine, feeling like dying and out of control on a daily basis. So I'm scared of keeping the streak for the birth and ending up in labor for days. And I'd like to have control over at least something in my pregnancy. Second, from what I've researched, it seems like C-sections in general come with less risk if they're planned than vaginal births, which sometimes also result in emergency C-sections. I'm not sure if my reasoning makes sense or not, but I don't think I can mentally and physically go through the pain and trauma of a vaginal birth. I am already at the end of my powers and I'm only 14 weeks along. It seems like elective C-section are looked down on and judged. Why? What are your thoughts on this? I'd also like to hear from moms that chose to have a C-section and how their experience was. So as a labor and delivery nurse, my thoughts on this are she is not alone. A lot of women feel this way. And the fear of childbirth, the fear of pregnancy are all very legitimate real world concerns for lots of women. And there isn't really space where people talk about that. And it's really unfortunate. But she's not alone. And I hope that she hears this in the Reddit post. However, she's only 14 weeks along, and I do think that, she has so many more weeks to go that hopefully she can talk to her doctor or midwife about how she's been feeling and perhaps what may be peripartum anxiety and depression, address those fears, and then maybe she will, one, be able to manage and navigate her pregnancy better, and two, hopefully decrease the amount of fear that she's experiencing. It's also important to note that as a nurse, I've seen multiple vaginal deliveries and also multiple C-sections, and I've seen labor turn C-sections, and C-sections are not easy. Now, in the context of having a very traumatic vaginal birth or a labor for days that turns into a C-section, then maybe a planned elective C-section mentally seems easier. But yeah, there are far more risks involved in a C-section. And I think a lot of people fail to understand that a C-section is really considered to be an abdominal surgery, a major abdominal surgery. So let's look at some of these replies. So Chelsbells89 says, keep in mind, while a C-section seems easier than vaginal birth, the recovery is a lot worse. You can't bend or lift and the pain is worse in recovery. So again, this is a very good point, but it's also a situation where not everything applies to everyone. Everyone's pain threshold is different. Everyone's surgery situation is going to be different. Every surgeon is different. So yeah, it's major abdominal surgery. We expect it to be painful, but my sister had a C-section and literally only took Motrin and felt fine. And no shade to my sister, but she's not normally a G. So I was really impressed with how she handled the pain, but she was just very comfortable, she said. So yeah, so each person will have their own experience. Kimber says, it totally depends on the delivery. My friend had a horrendous vaginal delivery with her first. In labor for 2 days, episiotomy, forceps. Yeah, this sounds horrible. Very almost an emergency C-section. She struggled with incontinence for almost 2 years, was not referred to a pelvic floor therapist due to COVID. But Kimber herself says that she, on the other hand, had a planned C-section for extended breech, 98% sure that the baby was not coming out bum first. And she was totally fine after about 4 weeks. So again, everyone's experience is going to be different. If you knew that you were going to have an episiotomy and a forceps delivery and a traumatic birth, you would probably prefer an elective C-section. And that would be likely far less painful than an episiotomy and forceps delivery. Oftentimes when a patient is delivered by forceps, there is significant tearing and all the way into the rectal mucosa. It can be really bad and devastating. So yeah. The next user, Crayon Zimmer, says, C-sections do not pose less risk than a vaginal birth. If that would be the case, we'd only do C-sections. There's just a lot to consider, your medical history, possible effects of the baby, etc. But that's all things you should ask your OB. However, you very much have a right to plan an elective C-section. There's a ton of information about the procedure online, and I bet your provider will be open for a talk with you as well. When you feel like you know enough to make an informed decision, go for it and ignore anybody who judges. It's your choice after all. I've heard many very positive stories about elective C-sections. Agreed. I think this is what this person should do, because if she's coming to Reddit with this question, then there are going to be people who pass judgment, and that's just what's happening out there. I call them the birth and pregnancy wars. Hollowed says, I've got a positive elective C-section story, two of them in fact. I flat out decided not to attempt a vaginal delivery and have never once regretted it. Why? Because a full third of American moms who attempt vaginal delivery wind up undergoing a C-section anyway. And for mom and baby, this is the least desirable outcome in terms of risk and recovery. This is an issue with the field of obstetrics, but I cannot change it. Since I wanted to deliver in a hospital, that was my reality. So I accepted it. I spoke with my OB. He said pick any day to schedule that starts after 39 weeks. I walked into the operating theater in my little blue gown and silly hat without experiencing a single contraction. I said good morning to the OR staff, lay down on the table, and 30 minutes later I saw my baby and felt this rainbow laser discombobulated maternal madness come howling out of my soul. It hasn't let up since, even though that baby is now a teenager wearing eyeliner. Don't let anyone tell you you won't bond with a baby delivered via C-section. I love this user because she gives acceptance and another perspective on having a C-section. And it's not like I'm pro C-section. I'm very much pro vaginal delivery because it's what's safest and, relatively easier as far as procedurally goes usually. But I know that there are these wars out here, and I want people to know how you birth your baby is up to you, your baby, and your doctor, and don't worry about what the masses have to say. So let me know if you have a fear of childbirth or if you have a preference of a vaginal versus C-section. My sister preferred C-section from the moment she found out she was pregnant. However, she was going to have an attempt at a vaginal delivery, of course. So, different strokes for different folks. It takes all kind to make the world go round. Let me know if you have any questions, comments, or concerns. And if you like these, please make sure you follow me for more. Let's grow this channel for all the mamas, expectant mamas out there. Bye, lovelies, and happy birthing.